My name is Dr. Aisha Saka. I brought in a patient here that received care in this facility. The patient is doing great. The patient had medical problems, which we visited a different private hospital in this same town. Unfortunately, we didn't get good care there, and so we had to transfer the patient down here on an emergency basis, and then called the ambulance, and they responded almost immediately in less than 30 minutes. And that was my own first time of getting an experience with this particular health facility. If I would describe the quality of care I myself and my family members have received from Cedarcrest, I would want to rank them as excellent. Being a health practitioner, that has worked in other facilities, being a health administrator, I would give Cedarcrest 100% over and over again. From customer care, reception, their response to emergency, quite excellent. The attitude of staff, which is a major problem in most facilities, is excellent in this facility. And then the facilities available, from the equipment, from the environment where the patient is, the service provision is quite excellent. The communication, again, it's also very excellent, because when you come into a health facility, most of the time the patients are usually noticed. They need someone to calm them, someone that can understand their language and communicate with them to their level. This was excellently done in this hospital. I have worked in my whole years of medical practice. I almost can say it's something I'm meeting in a facility for the very first time. At the point I asked myself, are we still in Nigeria? The next step will usually communicate. I see them doing their care in an anticipatory manner, and they communicate with the relatives without concealing information. And I think this is a brilliant one, because it's part of good ethical practice. In decision taking and making, they involved the patients and the other caregivers too. We had choices for our treatment plan, even up to the level of not just medications, feeding. It was that beautiful. For every decision making, the experts in that field will be sent to us to interact, and then we sit and take decisions at that level, at all points of management. The follow-up care post the emergency room was also quite wonderfully done. And as I speak, my patient is almost due for discharge, and together with the doctors, we're already talking about long-term follow-up of the patient in this facility. I would recommend, as much as I can, with each opportunity, any patient that knows the value of health, they said, is wealth, to Cedarcrest Hospital, Abuja. This for anyone that wants to access quality health care. Mind my word, quality health care in Nigeria. It's definitely available, and it's cheaper. If you are going to access care of this nature, you're going to leave the shores of this country, and you know what it means. So it's like getting what you are going to get outside right here under your nose. So more convenient, more cheaper, and you will not be disappointed anyway. That awareness for people to really know that this facility exists, and more people can benefit. Well, just to say once again to say thank you to the team, because healthcare delivery is a team. A general advice for patients managing chronic conditions that usually requires high-tech medical facilities for care. Cedarcrest is a one-stop a place for you to get your investigations, care done, and long-term follow-up, which is quite less stressful on the patients and the relatives.